cardiovascular system is the transportation system of the body. Cardio refers to the heart, and vascular refers to the blood vessels that take the blood from the heart to all parts of the body. Hi, I'm Kathy Getrust. I'm an instructor in community health, and today we're going to be talking about cardiovascular diseases. Some of the main functions of the cardiovascular system are to carry food, water, oxygen, and other vital substances to the cells, remove waste products from the cells, help control body temperature, and help maintain fluid balance. The cardiovascular system is made up of blood, blood vessels, and the heart. Blood, as you all know, is the red fluid that carries nutrients, chemicals, and waste products of the body. Average amount of blood in our bodies at any given time is about 4 to 6 quarts. The blood consists of two portions. There's the plasma, which is the liquid portion, and the lighter colored one that you're seeing. And there's the blood cells, which is the dark red portion of the blood. Blood carries oxygen and nutrients to the cells of the body and carries away from those cells carbon dioxide and other waste products. The blood is distributed through the body by way of blood vessels. Blood vessels that carry oxygenated blood away from the heart are called arteries. Oxygenated blood is blood that has oxygen added to it. As these blood vessels branch out, they become smaller and smaller until they are so thin that they're called capillaries. Capillaries are only 1 cell thick. Through these walls, gases, nutrients, and other substances are exchanged. After the blood cells have given up their oxygen to the cells in all parts of the body and exchanging other substances, it returns back to the heart by way of the veins. The heart is a pear-shaped muscular organ that's located in the chest slightly to the left of the breastbone or sternum. This breastbone and the ribs on either side of it help protect it from injury. This efficient pump beats approximately 100,000 times a day to circulate blood to approximately 100,000 miles of blood vessels throughout the body. The heart is divided into a right and left half by tissue in the center called a septum. Each half consists of 2 chambers, a right atrium and right ventricle, and a left atrium and left ventricle. The heart has a specialized conduction system that's responsible for the initiation and maintenance of the heartbeat. An electrocardiogram, sometimes just called an EKG, records the heart's electrical activity on a graph for analysis by healthcare professionals. Through the EKG, disturbances in the normal conduction system may identify some heart disease. As a person grows older, the movement of blood through the body tends to slow down. The heart muscle weakens, so the heart pumps blood with less force. The reduced output of the heart is one reason why older people tend to tire more easily than younger people do. The heart may also change in size. If it works harder to circulate the blood through the vessels, the greater work causes the heart to grow much larger. Much like lifting weights will increase the size of muscles. Blood vessels also can change as well. With age, they can harden and lose their ability to stretch. This causes them to narrow. Fatty deposits and other substances can also clog up these narrowed vessels. There are two main types of cardiovascular disorders: problems with the blood vessels that supply our body with the oxygen and nutrients it needs, and problems with the heart itself. First, I'll be talking about problems that occur with the blood vessels. Arterial sclerosis is a narrowing and hardening of the arteries. Maybe you've heard the term hardening of the arteries. That medical term is called arterial sclerosis. The arteries can also become clogged with fat and other substances called plaque to further narrow the inner lining of the vessel. Blood flow through these vessels is decreased, causing a lack of blood supply to body cells beyond that narrowed and hardened area. This condition is especially dangerous if it occurs in blood vessels in the brain, in the heart, or blood vessels that lead to the lower part of our body, in our legs. When the vessels of the brain are affected, the risk is high for a person to have a stroke, or CVA, also called cardiovascular accident, or brain attack. When vessels of the heart are affected, the person can sustain a myocardial infarction or heart attack. When the vessels of the leg are affected, the person may experience a cool skin temperature, they may have swelling, they may have pain on walking, and also can develop leg ulcers. When the arteries throughout the body are affected, high blood pressure may occur, also called hypertension. Varicose veins are another type of blood vessel disorder. These swollen, distended veins are especially prominent in the legs. Varicose veins can cause, or can be caused, by a lack of activity, can be caused by prolonged standing, obesity, as well as a loss of elasticity of the veins associated with aging. The signs and symptoms include a dull pain or cramping in the legs, and visibly prominent twisted and dilated veins that are visible by the eye. Treatment includes such measures as wearing elasticized stockings, elevating the legs, not crossing the legs when sitting, and providing for leg exercises. In severe cases, varicose veins may be tied off or stripped with a surgical procedure to decrease the threat of blood clots and leg ulcers. Another type of blood vessel disorder is called a cerebral vascular accident, or CVA. As I mentioned before, it's more commonly called a stroke. This is where there is a blockage due to a blood clot in the brain, or it can also be caused by a hemorrhage in a blood vessel. A blood clot formation in the brain is much more common, however. When this occurs, the patient may experience weakness or paralysis of any extremity or their face, or particularly it occurs on just one side and not both. So it might be one-sided weakness where the arm and leg become weak, as well as one side of the face may experience some drooping. They also might have visual disturbances, may only be on one side of the body that they notice that they are having difficulty seeing. There can be difficulty with speech, some slurred speech, some difficulty with swallowing. They may have loss of balance or stumbling that you notice when you're caring for them. Or they might have a change in their thinking called cognition. Example that comes to mind is I was with an elder friend and we were at the checkout counter at a grocery store and he had purchased a number of things. It was time to pay and suddenly he could not remember how to complete a check and sign his name, although he had done that for numerous times before. This may or may not be permanent. The symptoms may come on quickly, and they may last for just a fleeting moments to minutes to days, and it may or may not have permanent damage. In the situation with my elder friend, I reported the information. We got him to an emergency room quickly and was able to obtain treatment. There are, you may have heard of clot buster kinds of medications that are available now, which actually break up the blood clot that has formed in the brain, and by breaking it up, it allows the blood to again flow freely to all parts of the brain. If it's done quickly, no permanent damage may occur, and it can help improve the individual's status and prevent months and years of rehabilitation that may occur if permanent damage to a part of the brain happens. So the importance of reporting symptoms quickly so that treatment can follow as rapidly as possible is extremely important to their overall success. Hypertension means high blood pressure. Blood vessel disease increases the overall blood pressure. When blood vessels are rigid and less elastic, the heart has to work harder and exert more pressure to circulate the blood. An analogy comes to mind in the home. Pipes that we have that become clogged with calcium or other mineral deposits, there may be more difficulty in moving fluids through those pipes. May need to have a plunger force fluid through it to open them up. When the work of the heart increases, the heart becomes larger. Eventually, left untreated, the heart will fail to function properly. Hypertension is particularly dangerous because it's silent. There are very few, if any, symptoms of hypertension. Therefore, it's very important that you report to a supervisor any blood pressure of a resident that you may be caring for of a pressure 140/90 or higher. Many residents have some form of heart disease. When the arteries in the heart, called coronary arteries, lose elasticity or become narrow due to that plaque formation that I talked about earlier, the heart muscle receives less blood and oxygen. Physical exertion, stress, smoking, and other things can cause a temporary inadequate blood and oxygen supply to the heart. When this occurs, the patient experiences chest pain called angina pectoris or angina pectoris. The treatment for angina includes measures to increase the blood supply to the affected area. This may be accomplished by use of rest and medications such as nitroglycerin that can cause the blood vessels to dilate or enlarge, thus providing for increased blood supply to the heart tissue. Sometimes it's necessary for surgical measures to open up those coronary arteries. What happens is a stent is placed into the narrowed blood vessel, which opens the artery and prevents it from collapsing and allowing the blood to continue to flow. Be sure that you report any complaint of chest pain immediately to your supervisor. Another disorder of the heart is called a myocardial infarction, MI, sometimes shortened to be called, or a heart attack. This is caused when there is a blockage in one of these coronary arteries of the heart. Without being able to receive oxygen and nutrients, the heart tissue dies. Signs and symptoms include a crushing chest pain. Sometimes it spreads down the arm, particularly the left arm, or up into the neck and jaw. Sometimes the patient will experience shortness of breath, nausea, excessive sweating, or a feeling of impending doom. The treatment is designed to reverse the shock, relieve the chest pain, and keep the heart functioning as it should. Survival for these people depends on the fast medical intervention that must follow. There is a saying, time is muscle. That means that the faster that intervention happens, the more heart muscle is preserved. Report any signs and symptoms of this chest pain immediately to your supervisor. Congestive heart failure is another disorder of the heart itself. Sometimes it's just called CHF. It's often the final stage of many other heart conditions. A weakened heart muscle from a heart attack or a heart that has been stressed over a period of many years due to high blood pressure can cause congestive heart failure. It develops when the heart is no longer capable of meeting the oxygen and nutrient needs of the body. The heart is literally failing. Signs and symptoms of congestive heart failure include such things as congestion or fluid in the lungs, difficulty breathing. Sometimes you can even hear a moist, rattly breathing. Swelling, called edema of the legs and feet, and a generalized restlessness. Treatment includes such things as use of prescribed medications to remove some of this excess fluid. This medication is called diuretics. Also, there will be frequently administration of oxygen to make that breathing for the individual easier. Also, they may be given some sedative medication to reduce the restlessness that they're experiencing. Patients can live for many years with some amount of heart failure. Basic care includes measuring fluid for intake and output, preventing that individual from fatigue, pacing their activities, and keeping a calm environment for them. Report to your supervisor any unusual behavior or change in condition that you notice with your residents. The care given with any kind of cardiovascular disease is primarily devoted to decreasing the amount of work that the heart has to do and to observe and report any changes in condition. The activity of the patient with heart disease must be limited to what he or she is capable of doing. If the activity that they're doing causes chest pain or difficulty in breathing, the pace must be slowed. Rest periods should be planned throughout the day, and activities should be scheduled around the rest periods. Too often, the needs of the facility trumps the needs of the individual. It's not at all uncommon to get an individual up in the morning, have them get dressed, provide for their personal hygiene, immediately have breakfast, and whisked off to some activity. That may not be possible for an individual with heart failure. Anger, frustration, and emotional upsets can also increase the workload of the heart and raise blood pressure, so providing for a calm environment is also important. Many patients with heart disease have difficulty breathing and require special positioning to help them breathe easier. Some may need to rest in a semi-sitting position supported with 2 and maybe even 3 pillows. Swelling, again called edema, in the legs and feet interferes with circulation of the blood, which can lead to skin breakdown. Keep the legs elevated as much as possible to reduce that edema. Elevating the legs improves the flow of blood back to the heart. In order to decrease the workload of the heart, the patient needs to be at a weight that is appropriate for his or her body height and build. Many times the physician will order a calorie-restricted or a fluid-restricted diet. The patient may need a good deal of support and encouragement and teaching in order to follow that diet. Most patients with heart disease have a problem with fluid retention and overload. Fluid retention, as mentioned earlier, causes the heart to have to work harder and produces excess edema. An important factor related to fluid retention is sodium or salt intake. Salt causes the tissues to hold onto water. Foods that are naturally high in salt are such things as cheese, bacon, cold cuts, and canned soups. Salt restrictions are not easy to live with, and patients often complain that their food is bland and doesn't taste very palatable. Salt substitutes are available that can help enhance flavors. Other things besides salt substitutes might be the addition of other spices that don't have sodium in them, or things like lemon can improve the taste of things. Helping patients understand the reason for dietary restrictions may help them follow them a little more easily. When you as a caregiver recognize the signs and symptoms of various forms of heart disease, you're able to notice subtle changes in your patients and report them immediately. Medications and treatments can then be started before an emergency arises. Note changes in blood pressure if you're able to take blood pressures in your facility and compare those to previous readings. Also pay particular attention to the rate, rhythm, and pulse of your patients as well as their breathing pattern. Observe and report any sudden changes in behavior, orientation, sleeping, and eating patterns. Pay particular attention to circulatory changes such as the presence of swelling in their legs. Never assume that the symptoms are due to old age or that your patient is just a complainer. All symptoms of chest pain, difficulty breathing, or even the patient's report that he or she is feeling different or strange needs to be reported so that it can be acted upon quickly. Since the early 1900s, heart disease has been the leading cause of death in the United States. There is a great deal of interest and public education concerning ways to lower the risk of heart disease in this country. Obviously, some risk factors such as a person's age, family history, or gender, whether you're male or female, cannot be modified or changed, but the American Heart Association has identified a number of major risk factors and health-promoting behaviors that can be changed to decrease the risk of heart disease. I'd like to cover now some of those major risk factors and health-promoting behaviors that can be done to prevent heart disease. First major risk factor is hypertension or high blood pressure. A health-promoting behavior that can happen in order to decrease that risk is to have regular blood pressure checks so that if the blood pressure is creeping up over 140/90, early intervention can occur. Also, for those that have a history of high blood pressure, to be sure to take that high blood pressure medication to keep it under control and to reduce the amount of salt in the diet. High blood cholesterol is another major risk factor for the development of heart disease. That means reduce the amount of fat and other fat intake in the diet. Maintain the ideal body weight. Increase the amount of carbohydrates and vegetables in the diet. Smoking is another major risk factor. One health-promoting behavior that can occur is to enroll in a structured program to stop smoking. You may need, if you're a smoker, to change your daily routine that's associated with smoking to reduce that desire. And ask family members to help support your efforts to stop smoking. Physical inactivity is also a known risk factor for the development of heart disease. A way to combat that is to develop and maintain a routine of physical activity at least 3 times a week. Incorporate physical activity into your daily routine, such things as taking the stairs instead of the elevator, parking your car a fair distance from the buildings that you're going to be accessing, riding a bike instead of always taking the car. A stressful lifestyle is another major risk factor. Ways to combat that is alter your pattern that may increase stress in your life, such things as rushing. Maybe you would need to set your alarm 30 minutes earlier so that you're not as rushed in the morning. Will help reduce the amount of stress. Maybe meditation may help reduce the amount of stress in your life. Try to set realistic goals for yourself and not cram too much into a given day. Reassess priorities in light of health needs. And plan time for adequate rest and downtime. Obesity is another major risk factor. Try to reduce the calorie intake. Eliminate the amount of fast foods that are eaten. And avoid crash diets, which usually in the long run don't work anyway. Diabetes mellitus is also a risk factor for the development of heart disease. People who have diabetes need to follow the recommended diet, make sure that they're monitoring their blood glucose levels regularly, and make certain that their medication, if they're on insulin, is taken on as prescribed, and that they have regular scheduled communication with their health care provider. New techniques for the treatment of various forms of heart disease and an increasing amount of health-conscious American society are contributing to a reduction in the number of deaths due to heart disease. It's helpful to understand what heart disease is, which ones are most common, and how you can assist patients who have heart disease to lead healthy, productive lives.